This is a very significant graduation for me. My dad graduated from his pharmacy degree 30 years ago, and he's been a role model for me through my life. I've always seen him as kind of a super pharmacist, so living up to those standards has been quite daunting. But he's always been a big support for me and has helped me get through it. But it's also one of the reasons I decided to take a little different, less traditional path. Through my experiences on clinical rotations, I noticed that there were systemic barriers to care that pharmacists were just expected to find workarounds for on the fly. And though I like to think I'm pretty resourceful, I like to fix gaps permanently and not just keep patching over the same problem every time I encounter it. Pharmacists these days are expected to be stretched very thin, be extremely adaptable, and provide sound therapeutic advice at a fast food pace. And I really want to change this status quo, not only for pharmacists, but for patients as well. And through the research project that I did over my years at Dalhousie with Doctors Kyle Wilby and Joanne Wilson, I was encouraged to think outside of the box and find permanent solutions that other people may not think of. And it was very encouraging, and it ignited a passion in me. And so I'm going to be continuing to do a master's in pharmaceutical sciences at Dal. And I'm hoping to learn how to properly implement lasting changes on a systemic level to help provide accessible care for everybody, regardless of what they look like, how they present, or how they identify. I never thought that after struggling through this degree, I would willingly sign up for 2 more years. But that's kind of what happens when you find a passion. You do crazy things like sign up for another 2 years after you've already done 8 years of academia. And I think that my path will continue to be rewarding, and hoping to break some barriers and build up new facilitators in the process. So keep an eye out for me. Hopefully I'll be in some papers sometime soon. Thank you.